What is trauma? We have all experienced trauma of some kind. Trauma can be physical or emotional. A physical injury causes physical trauma to the body. Emotional upset or any kind of distress that is hard to bear can lead to emotional trauma. How does the brain respond to trauma? Immediate trauma, like acute pain or injury, lights up the brain's survival center. In the picture, you can see the thalamus. It's responsible for registering pain. Long-term trauma or severe pain can cause the brain's survival center to light up long after the trauma event. This can happen without your awareness. Survival responses are automatic. Our brains respond to trauma automatically. This response takes place in the survival area of your brain. This area is deep in our brain. We can call this area the limbic system. Thanks to technology, we can see how our brains look in acute stress. This scan is of a patient having a flashback. We measure the activity of a brain by seeing how much glucose the brain is using. Red and yellow show very active areas of the brain. The limbic system, at the bottom of the image, is using heaps of glucose. The dark blue shows areas of the brain that are not very active. At the left arrow is the thinking, planning area of the brain. Brain fog is common in severe chronic stress. The survival part of the brain sees stress as stress. Physical and emotional stress affect the survival part of the brain in the same way. If the fight or flight part of the brain is activated, your pupils can dilate, mouth will go dry, your neck and shoulder muscles tense and the rest of your muscles tense for action. Your heart pumps faster, you can have chest pains, palpitations, sweating, and you will breathe faster. Hidden effects are where the brain gets the body ready for action. Your adrenaline is released, your blood pressure rises, your liver releases glucose to provide energy for muscles, and your digestion slows or ceases, and your sphincters close. A freeze response is automatic. If you feel stuck, cold, frozen, numb, if you get a feeling of stiffness or heaviness, or you're holding your breath, if you have this sense of dread or your heart pounding, you can have your heart rate going down and feel a looming sense of threat. This response is common in the face of inescapable danger. The longer your brain experiences a stress response, the more it affects your body. You can develop pain in all different areas of your body. And your mood and emotions can change. There are many different experiences: sadness, frustration, stress, despair, depression, anxiety, pessimism, and feelings of hopelessness. Why do we need to learn about trauma? Trauma can be treated. When we are traumatized, we often don't recognize our own traumas. Reaching out to others can help. Learning about trauma is worthwhile.